Hello and welcome to PSYCH-MAN. Today's topic would be antisocial personality disorders. Now, before moving forward, I want you to understand what are the things that we'll be looking into today. First, we're going to be introducing the topic of antisocial behavior itself, and then we'll be looking into what antisocial personality disorders are, what are its symptoms. Then we will try to distinguish between psychopathy and sociopathy. We will try to also understand what causes antipersonal personality disorders, what is the diagnostic criteria, and how we can treat antisocial personality disorders. Now, moving forward, let us just introduce what is antisocial personality disorders. So we know that an antisocial personality disorder is essentially a personality disorder. So what is a personality disorder? A personality disorder are mental health condition that affects how someone thinks, perceives, feels, or relates to other things. In a nutshell, we can say that a personality disorder is a disorder of personality through which a person tends to behave in its characteristic trait, right? So someone thinking about certain things and ideas, someone perceiving things like there are personalities which are pessimistic, so they always see and perceive things negatively, while there are optimistic personalities which always sees things, perceive things, feels things, in a way which is positive in nature. Now, what is an antisocial personality disorder? Now, an antisocial personality disorder is a condition characterized by lack of empathy and regard for other people. So, one of the most important things that you need to understand in antisocial personality disorder is that, first of all, it is antisocial. Second of all, it is characterized by lack of empathy. So, what is empathy? Empathy simply means how you relate to other people's feeling. Do you even relate to it? Do you understand it, or do you not? When certain people with antisocial personality disorders have immense lack of empathy, they don't want to feel what the other person is feeling. Like if somebody who's having an antisocial personality disorder will essentially say that whatever they do or say to other people hurts them, but they would find no regard towards other people. In a way, it's an immense disregard towards other people's feeling and understanding and how certain things could be hurtful for them. So lack of empathy, very important criteria. Now, individuals with this disorder always or may tend to lie, which is they lie about things. Uh, in a way, they have a charming personality, so they are kind of charmers, and they use oftentimes lies to charm other people to get into their personal space to invade it, right? Now, usually antisocial personality disorders also is something in which there is a grave danger of violence or violent behavior or aggressive behavior. And most often, this person suffering from antisocial personality disorder lacks empathy, and they might conclude themselves committing some criminal activity, whether it's robbing someone or hurting someone or assault, physical assault. It could be many things. So it is uh, has some sort of a criminal activity range. So what are the symptoms? Usually, when we want to diagnose someone with an antisocial personality disorder, we talk about certain symptoms and follow the criteria in DSM-5. Uh, but um, symptoms do occur in childhood itself, like behaviors generally show, like behaviors of cruelty, especially against animals, like if there's a small cat or anything which is uh, small and frail and cannot, uh, you know, save itself from the humans. So you will see children often committing cruelty to animals, like certain people commit cruel acts against cat, dogs, so pets, right? They like to dissect them. They like to understand different body parts of it in a way that is satisfactory and gratifying for themselves. And activities like fire setting, activities in which they have difficulty following orders of authority, whether it's school or home or any other general place in social structure, difficulties with authorities. Often this lead to legal problems, right? As they are unable to conform with the norms of the society, and they don't understand the rights of others, and they feel that they can invade those rights, right? So, oftentimes these are impulsive behavior. Impulsive behavior simply means behaviors which are carried out without thinking a lot, which is in the feet of emotions or oftentimes aggressive in nature. And impulsive behavior also implies that they don't uh, do or commit certain behaviors simply do simply by understanding what kind of consequences that their actions could have for other people or even for themselves. There's a great amount of aggressiveness, which can also lead to physical assault, mental torment for the people who is or for the object of aggression. Um, Difficulty feeling empathy for others, not understanding other people's emotions, something like that. Now, there is no remorse for damaging behavior. But that being said, lack of empathy simply means if I commit a certain behavior which is hurtful for other people, so I would have no remorse over it. If I slap someone or punch someone and it hurts that other person, it also torments him mentally in terms of humiliation if I'm doing it in a public place. But if I have antisocial behavior and I'm doing it, it simply means that I would have no remorse, regardless of whatever my actions are. So deceiving and lying is another thing that is done, and it is only done for personal gain. There's no bigger picture out there. It is just for personal satisfaction and gratification. So the modern diagnostic criteria follows like uh, different uh, symptoms that needs to be present for someone to be diagnosed with an antisocial personality disorder. Okay, so we follow DSM-5. Now, there are two distinctive conditions. One is psychopathy, and the other is sociopathy. You can call them psychopaths or sociopaths. In terms of prevalence rate, it has 0.2% prevalence rate according to DSM-5, right? So almost 3.3% of U.S. adults have antisocial personality disorders, and these conditions tends to affect male more than females, right? So let us understand what is psychopathy and sociopathy. Now, a sociopath and a psychopath is distinctively different in one sense, is that a sociopath is a product of the society, like someone who is born in a rough neighborhood and who has always seen some sort of violence against people, and they learn this violent behavior because they felt that the only time they're in control of situations, whether uh, it can be any kind of situation, is when they turn to violence or turn to antisocial elements, right? So it's a product of society in a sense. While as a psychopath uh, is essentially has an innate behavior of antisocial elements, right? So psychopaths often pretend to care about the situation as they are good charmers. So they use lies and they try or pretend that they're caring enough, but in a way they're not. Um, while as sociopaths make it clear that they do not care how other people feel. Like a sociopath would always show his behavior direct, whereas a psychopath would always, cover it in a good way, right? They will make you feel like they're a good person, but in the end, they're not. Okay. While a sociopath doesn't give a damn about any of it, they just don't care, right? Um, Sociopaths uh, are believed to be hot-headed, oftentimes impulsive, while as a psychopath is always cold and calculated. Okay, so their behaviors are more cold, calculated, and less impulsive and more calculated behaviors. Um, a psychopath always has no recognition of other people's emotions, right? So they fail to understand the kind of distress a person is going through. While a sociopath prone to be more driven by impulsivity, is more angry, and has more rage, right? Um, Psychopaths do maintain relationships, but they are shallow and they're fake. They're not real relationships. They are relationships that don't give any meaning uh, to them or has any real reason for them to be committed. They always have shallow and fake relationships, oftentimes uh, based on lies and deceit, right? Um, but on the other hand, a sociopath knows what they're doing. If they're committing a crime, they know they're committing a crime, but they always rationalize it as to say that the society deserves it. They made me this way, so they have to be dealt with, saying that they will be dealing with them. Psychopaths are more like they have this second phase, or we call a persona in psychology, in which they show that they are living a normal life, but underneath it, they're actually committing crimes, and they're in a way living two lives. One for the society, which is a made-up life, and then real life is a criminal life in which they uh, want to really uh, do what they feel is gratifying to them. Um, and psychopaths, as I said, has no remorse, no emotions, so they don't even get attached to anybody emotionally. Um, on the other hand, sociopaths are hard to maintain regular work or family life because of impulsivity, of course. And on the other hand, psychopaths may love people in their own ways, right? So they have their own way of loving. It could be sadistic in nature or it could be something else, but that's how they do it. While sociopaths do have emotional attachments, but it is difficult for them to process it. Now, what are the causes? Now, one of the most important causes of antisocial personality disorders, especially for psychopaths, are genetics. Okay, so research suggests that ASPD, which is antisocial personality disorder, is likely strongly linked to inheritance, and that environmental influences probably exaggerates its development. As to say, it's genetic factor like a psychopath's brain works in a way or is wired in a way that uh, doesn't show any emotion, even in the most tough situations. Like if somebody is giving you a ticket, right, for overspeeding, a psychopath, even though if he has a dead body in his trunk, would act so normally and would be so patient because they don't have that emotional response, right? So it's genetically, their brains are wired in that way. And environmental factors play another role. They can exaggerate this, or they can, make these symptoms more severe in the future. Second is upbringing. Like most of the serial killers that I've seen, most of them have psychopathy, or most of them have antisocial personality disorder. Oftentimes, has been seen that they had been abused in childhood, or they have been either neglected. Like I remember the case of Jeffrey Dahmer, who was who suffered from this thing, that he had parental neglect, and he was finding his own sexuality as a gay person, and his deviant behaviors came out in the future, And so neglect plays a role, childhood abuse plays a role, and some sort of a trauma. Uh, for example, if you see Ted Bundy, right? So he had a trauma when he realized that the person that he was considering his elder sister was actually his mother, and Ted Bundy was a child in a way, what we call a bastard child. So upbringing plays a role, and upbringing is more of an environmental factor than an innate factor. Now there is difference between brains, right? So research says that I said the wiring of most of the people suffering from antisocial personality disorders is different compared to normal people. So these differences are in frontal lobe area, which plays a crucial role in planning and judgment of what a vehicle is supposed to do. So the diagnostic criteria is disregard for safety, of self and others. Like person suffering from antisocial personality disorder, if you want to know what is the diagnostic criteria according to DSM, it simply says that there is no regard for people's safety, and it also applies to themselves. Like they would also cut themselves to see how does it feel, right? Um, they fail to obey any laws that has been saying implies in the name itself antisocial. So everything that is antisocial, they will do it. Impulsive behaviors. They have impulsive behaviors which are done, which are aggressive in nature and oftentimes are not considered before doing. They are oftentimes irritable, really easily irritable. Even by the smallest thing that is so much negligible and trivial, right? Um, and they're aggressive. They have no remorse for whatever they have done, and they like to lie and manipulate others to get their own things done. It may be for their own amusement or gratification, and they oftentimes uh, are irresponsible, right? So this is what we have learned about uh, antisocial personality disorder. If you like this video, please uh, share this video, subscribe to my YouTube channel, and uh, and 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 please let me know if there is anything else that you want me to cover in the next video. Thank you. Oh, I'm sorry. I forgot to talk about treatment, so I'm gonna just talk about it right now. So treatment is basically um, is very difficult to treat because it is sometimes genetically done. But you can also give them psychotherapy. CBT used to work here, but it's oftentimes really difficult to get these people in therapy. So that is something that you need to consider. So that is what we know about antisocial personality disorder. I hope you like this video. Share it and let me know what do you want to know in the future.